Knock, knock. Getting my alcohol to sanitize my hands. Hi, Miss Amber. My name is Keisha Luna, and I'm going to do a health assessment on you. First of all, I wanted to ask you, do you mind if I touch you in any areas?
No.
Okay, perfect. Can you state your whole name?
Amber Poche.
Can you give me your birth date?
5887.
And can you tell me what city you're in right now?
Port Arthur.
Perfect. Okay, first of all, Miss Amber, I'm going to have you stand up. And I'm going to be inspecting the back area, the posterior chest wall. I'm going to be looking to make sure that the scapula are symmetrical. I'm going to make sure that the thorax is symmetrical. And I'm going to make sure that the spinous process is going downward in a straight line. Perfect. Then I'm going to check symmetry. If you will, just take a big deep breath in. Make sure the lungs are expanding and coming in together. One more time. Perfect. While I'm here, I'm going to be checking for the kidney. Let me know if you have any pain here.
No.
Perfect. And here.
No.
Perfect. Okay, if you will, have a seat, Miss Amber. Oh, no. I need to palpate here, and when I do that, I need you to say 99 each time I touch you.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Now I'm going to percuss and just check if there's any pain in the lung field here. Let me know if you feel any pain or tenderness as I'm doing this. Perfect. Next, Miss Amber, I'm going to actually listen to the lung sounds, lung field, and the breath sounds, okay? Just take deep breaths for me. Perfect. Don't hear any advantageous sounds here. No wheezes, no crackles. Perfect. Okay, if you will, have a seat for me. Okay, now I'm going to check the carotid artery. I'm going to palpate and listen for it, okay? Just going to palpate, touch here, make sure there's pulsation going on here. Perfect. Okay, now I'm going to listen to the carotid, make sure there's no bruise. Take a deep breath in and hold. Perfect. Same thing. Perfect. Okay, now I'm going to listen to the lung sounds right here. Going to check your lung fields, make sure there's no wheezes or crackles. No advantageous sounds. Perfect. I'm going to look for respirations. Make sure that your respirations are even and unlabored. Make sure that you're not using any accessory muscles here upon breathing. You're just breathing normal. Okay, perfect. Now I'm going to palpate. Same thing as on the back. I just want you to say 99.
99.
Perfect.
99. 99.
Perfect.
99. 99. 99. 99. 99.
Okay, perfect. And then I'm going to percuss. Make sure I don't feel any tenderness, or make sure you don't feel any tenderness while I'm doing this here. Okay, now I'm going to listen for your heart sounds. I'm going to listen to the aortic artery, pulmonic artery, Erb's point, tricuspid valve, and mitral valve. Okay, perfect. If you will, can you lay back for me, Miss Amber? Okay, as you're laying back, I'm going to be looking for jugular distension, and I'm going to be looking at your pericardium. So if you will, turn to the left, looking to make sure that your jugular veins are not distended. Turn to the other side. Perfect. No jugular vein distension. Your pericardium is good. Okay, and now I'm going to listen to your heart sounds. Listening for the aortic area, the pulmonic area, the Erb's area, the tricuspid valve, tricuspid area, and the mitral valve. You can hear it really good while you're laying down. Okay, next I'm gonna listen for bowel sounds. So I'm gonna start in the right lower quadrant. I'm gonna listen for any hyperactive bowel sounds, hypoactive bowel sounds up in the right quadrant, and the left upper quadrant, and the left lower quadrant. And if I didn't hear any bowel sounds, or if they were hypo, I would listen for at least 5 minutes in each quadrant. But they sound fine. Next I'm going to palpate the area. Oh, no, next I'm going to listen for your arteries in your abdomen. We're going to start with the right femoral artery, the right iliac artery, the right renal artery, your aorta artery, your left renal artery, your left iliac artery, and your left lower artery. Perfect. Okay, now I'm going to palpate your abdomen. Make sure that that you don't feel any pain or discomfort. I'm going to lightly palpate here in all quadrants. Perfect. Next, Miss Amber, I'm going to deep palpate. And what I'm going to do is I'm going to go a little bit deeper than what I did before. So let me know if you feel any pain or tenderness here, okay? Going a little bit deeper than what I did before, just to see if I can feel anything here. Perfect. Okay, while I'm looking at your abdomen right here, I'm just looking for any skin discoloration, any scars, any striae, any masses or any lumps. I'm just taking a look and inspecting the skin here. I'm going to lean over and I'm looking at the umbilicus to make sure that the umbilicus is inward, not outward. Looking to see if there's peristalsis or palpations going on. Everything looks normal and fine here. Okay, now I'm gonna palpate for your liver, your spleen, and your kidneys. So what I'm gonna do is I'm gonna reach back here, up under your back, and right up under your rib cage on the right hand side. I'm gonna palpate right under here for the bottom part of your liver, right there. Perfect. On the other side, the left side, if you will lean over for me, I'm gonna palpate right here up under the rib cage for the bottom part of the spleen right here. Perfect. And then I'm gonna palpate for the kidney, which I'm gonna reach right down here and come down a little bit lower. Feel a little bean shaped right here for the kidney. Perfect. Okay, Miss Amber, now what I'm gonna do is I'm gonna feel for your appendix, make sure there's no appendicitis going on right here. The first one is gonna be Murphy's point. And what I'm gonna do is I'm gonna press in, and if you feel any pain, let me know. I'm just pressing in real quick. Any pain there? Perfect. Okay, now I'm going to do the Bloomberg test. And what that is if I press in and release it real quick, do you have any pain there? Okay? So I'm pressing in and release.
Nope.
No pain there? Perfect. Now I'm going to go to the opposite side and do the Robsing's test. And what that is, it's a rebound pain. So if you feel any pain on this side, let me know. Any pain there?
Nope.
Perfect. Okay, one last test that I'm going to do is a muscle test. It's called the LSCO test. And what you're going to do is you're going to raise your right leg for me. As you're raising it, I'm pushing down on that muscle to make sure that your muscles are working good. Perfect. Okay, you can relax. Ms. Amber, that does conclude my assessment. During my assessment, I checked for the posterior and the anterior chest wall, listening for breath sounds, any advantageous sounds. I was listening for or percussing to see if there's any tenderness or any pain involved. I did listen to the aortic, listen for any bruits, and I also listened for the heart sounds. I did hear heart sounds. I heard the S1 and S2. No murmurs were heard. No other sounds were heard. I did listen to the aortic areas or the arteries in the abdomen. I did hear all the arteries there. There was bowel sounds in the abdomen. They were not hyper nor hypo. They were just normal bowel sounds. I did feel for the liver, the spleen, and the kidney. And I checked for Murphy sign, Bloomberg sign, the Robsing sign, and the iliopsoas muscle test sign. Thank you.